Hi everyone, welcome back to Pet.Vet. Pyometra or pus in uterus is a commonly affecting condition in female dogs. Female dogs that have not been spayed is more prone to this condition, even though pyometra is rarely seen in wild bitches and young females. In this video, we are going to discuss about the causes of pyometra, the signs and symptoms, and the diagnosis. Please subscribe to Pet.Vet for more such informative videos. Pyometra is defined as an infection in the uterus. It is a serious and life-threatening condition that must be treated promptly. Pyometra is a result of certain hormonal changes that occur in a cyclical manner in the reproductive tract of female dogs. After many years of estrous cycles, the wall of the uterus undergoes various changes like thinning, thus promoting the disease. Can pyometra occur in pregnant bitches? Pyometra is also reported in pregnant bitches. Either the infection enters through mating or due to early embryonic death. Signs and symptoms. There are two types of pyometra. One is open and other is closed. In the first case of open pyometra, pus will drain out because the cervix is open. It's often noticed on the back side of your dog or in the bedding or where they have laid. It may or may not be accompanied by fever and loss of hunger. Second is closed pyometra. If the cervix is closed, pus is formed that won't drain outside. It collects in the uterus, causing distension of the abdomen. Dogs become very ill of feet. Dogs may also have vomiting or diarrhea and an increased thirst. Coming to the diagnosis. Open pyometra is easily diagnosed because of the discharge. But closed pyometra sometimes go unnoticed, and usually it is diagnosed only when the bitch gets seriously ill. A very ill female dog that is drinking excess water and not sterilized is always suspected of having pyometra. Blood count, X-rays and ultrasound are the diagnostic methods used to identify the condition. Treatment. Treatment of pyometra involves surgical removal of the uterus and ovaries. The spay that is advisable. Antibiotics and fluids, other supportive therapy becomes necessary. Hope this video was helpful. With lots of love for your little ones, this is Dr. Jizana signing off. Thank you.